My name is Laura Delfino. I am a third-year DVM student and lab technician in Dr. Dan Regan's lab, the Investigational Pathology lab.
2 transitional cell carcinomas and 1 melanoma for the human lines.
One of the main purposes of the lab is to look at the tumor microenvironment, or what makes these tumors unique and what makes them something that we can target. And so we actually found a couple of different targets in osteosarcoma or bone cancer that's both found in humans and in dogs. And so what I am doing is I'm evaluating 2 new drugs to see if they will work as potential therapies to hopefully better survival rates for osteosarcoma in both dogs and humans.
My name is Laurel Haynes, and I am a DVM PhD student, and I work in Dr. Dan Regan's lab in the Flint Animal Cancer Center. Currently, I'm researching the basic fundamental mechanisms of osteosarcoma metastasis to the lungs, and I hope that by understanding this process, we can revitalize this field of osteosarcoma therapies that has been pretty much dormant for the past 3 decades. I like to just think about how my work is going to impact people's lives one day.
This work is super important because the survival rate for child osteosarcoma is in the 60%. That means 1 out of every 2, just a little bit over, are not going to survive past 5 years. And that's a really low number. And so I'd like to be able to impact that. But even for the canines, there's about 10 times higher incidence rate of osteosarcoma in dogs than there are in children.
I'd say if we had to sum up the lab in 2 words, it's a translational oncology lab. And by translational, we're trying to take therapies, basically anti-cancer therapies, where we start on the bench, right, with just cancer cells in a dish, and we treat them with drugs and we look for effective therapies there. And from there, we try to translate these into our canine population here, our hospital patients that come into the veterinary clinic, and we see, are these truly effective and a more relevant surrogate of the human disease? And ultimately, the goal is to take that information and move it into a human clinical trial in human cancer patients.